Good evening. I appreciate everyone coming out this evening. It's good to see a lot of old familiar faces and some new ones. Quick overview in terms of what we've been working on in the center and continue to work on. Our focus at the center is on conditions of chronic illness, specifically chronic pain, and chronic neuropsychiatric illness. That is, issues with depression, issues with generalized anxiety disorders, post-traumatic stress syndrome. And one of the things that got us here, because we started off as family physicians and we started off as pain specialists, and one of the things that got us here is the understanding that there was a massive overlap between these conditions. And we were seeing very large numbers of people who were suffering with both. And the problem was that if you have a chronic pain condition, or if you have a neuropsychiatric condition such as depression or anxiety disorders alone, your odds of recovering are about 50%. Not great, but at least we get some recovery rate. In the literature, if you happen to have both conditions at the same time, your odds of recovery drop to 10%. Absolutely abysmal. So what that told me was that we clearly had no idea what we were talking about when these conditions were occurring together, and we didn't understand what they were. And what we thought was that depression and chronic pain caused inflammation and dysregulation in the brain. And we saw that through numerous studies, as we saw that these conditions are neuroinflammatory and neurodegenerative in the central nervous system. And when they occur together, that factor is compounded multifold over. What we've learned, however, is that inflammation, dysregulation, and degeneration of the brain, actually cause depression and chronic pain. So this is actually a very major shift in our thinking. And we're now talking about what we refer to as a neuro-immune model. The issue is then, what is it that causes inflammation in the central nervous system? And this gets down to this business of disease versus symptoms. And what do I mean by that? Many years ago, I was an emergency room physician, and a gentleman came into the emergency room complaining of excruciating shoulder pain. All right, couldn't move his arm, really was about, beside himself with pain. He also, however, looked a little ashen, he was a little short of breath, and so we took a listen to his chest, found he had an irregular heart rate, and then decided to do an EKG. He's in the middle of a heart attack. All right, that shoulder pain was a consequence of his heart failing. We treated the heart attack, the left shoulder pain resolved. Had we been focused on the shoulder pain, treated the shoulder pain, and sent him home, he would have died. This is about treating the symptom as opposed to treating the disease. We do the same thing day in and day out with regards to depression and chronic pain. So we started to look at, and by we, there was a group of other physicians, psychiatrists, that I got together in a study group a number of years ago, and started saying, okay, what is it that mediates inflammation in the central nervous system? And the answer turns out to be a thing called the microglia. And the microglia, you can imagine, is kind of this defensive shield around the brain. They are the innate immune system of the brain. And so they respond to any damage to neurons in the central nervous system. And so if you know that piece of information, then you can turn around and say, okay, what is it that upregulates, causes the microglia to move into an inflammatory state? Well, one thing is infection. So certainly Lyme disease comes to mind immediately, but meningitis, we've seen people who've had malaria and dengue fever, all of which upregulate microglia, cause them to move into an inflammatory state. Physical trauma, concussions, is something that can do it, and hypoxia. Hypoxia is things people don't generally think about. That's loss of oxygen to the brain, but actually occurs in 5% of people in this country every single night. It's called sleep apnea. And only about 15% of the people who suffer with sleep apnea have been diagnosed to date. So it's a big problem, and if we don't think about it, we don't ask the question, we don't end up with that answer. Psychological traumas certainly play a significant role in terms of causing upregulation of microglia because they destroy neurons, all right? We now have studies demonstrating that not just things such as severe traumas, rape and war, but rather things such as chronic daily stress, high stress situations actually results in degeneration of neurons. Bullying results in degeneration of neurons and turning on the inflammatory processes. This was a study that just came out about 6 months ago. So psychological traumas absolutely cause inflammation in the central nervous system, and we have to figure out ways to address it and make that as part of a comprehensive program in order to help people recover. Additionally, things like celiac disease, about 1% of the population has celiac disease, but about 6% of the population has gluten intolerance. And there are other foods as well that can cause inflammation in the central nervous system. These are not everything, but they are some of the major things. The point is, by understanding that our target is after what is it that upregulates the microglia, we can start creating a process by which we think about how people got sick and why they stay sick. And what happens is, as a result of these things and this inflammation, what comes out? What comes out is pain, depression, anxiety, fatigue, sleep issues, headaches. So these are the symptoms of inflammation in the nervous system. All right? In an acute situation, what does upregulated microglia look like? It looks like the flu. You've got a headache, you've got generalized malaise, you have high fevers. Okay, everything aches, everything hurts, you have sleep disturbances. Now put it into a chronic situation where those microglia never go back to normal regulatory processes. So a couple of things come out of this. We know that chronic pain and depression are symptoms of inflammation in the brain. All right, I repeat that over and over again because my colleagues take a while to learn things. This is not my opinion. This is what is in the literature. This is what is very much backed up by lots and lots and increasing amounts of scientific literature looking at what's going on in these situations. And this is how the National Institute of Mental Health is turning around and saying, okay, look, we're going to go by biomarkers, not by symptoms. And the biomarkers happen to be functional MRI studies and the cerebrospinal fluid studies demonstrating inflammation and degeneration in the central nervous system. The other thing to keep in mind about this is that because this is a neurodegenerative disease, the longer it's in the system, the harder it is to get rid of. All right? And so we start seeing people aging out, if you will, by the time they're in their 50s and 60s. We have far less success in getting total recovery on these individuals, and we get more commonly partial recovery because there's been so much neuronal damage that's gone on. The other thing that we've learned over time is that usually by the time chronic pain erupts on the system or depression and other things erupt on the system, the issue is one of cumulative assaults. So it's not a thing, but really it's multiple things that do this. And we have to go after all of these things. Okay? If you have 16 nails in your foot, we remove 8, you still have 8. So if we're going to be serious about getting all of this stuff fixed up so that we can get you back to total health, then we have to begin to address all of the things that got you there. So total recovery is possible. We have to treat individuals, not symptoms. So we've got to really spend the time to get your history and figure out what's going on. And treatment needs to be holistic and comprehensive. Now, because we know that this is neuroinflammatory in nature, then we turn around and we say, okay, what are the things we can do in order to reduce inflammation in the central nervous system? Well, it turns out that there are a number of things we can do. Exercise certainly becomes one of the things that reduces microglial activity and actually causes growth of new neuronal tissue. All right? We know that there's issues with sealing the gut and addressing nutritional issues that have to be addressed. We know that getting a good night's sleep is absolutely essential. Okay? So the fourth pillar on this is meditation. And meditation is actually crucial to good brain health. Meditation actually causes rebuilding of damaged neuronal pathways and reduces inflammation in the central nervous system. Again, not my opinion, by evidence of extensive studies. Our speaker tonight, Dr. Deborah Norris, has done extensive research in this field, looking specifically at pain and the use of meditative techniques. She's a psychologist in both private practice and a psychologist-in-residence at American University. She has long-standing experience doing research in mind-body medicine. She's also a neurotoxicologist in another lifetime and has a mind-body center in Washington, D.C. I'm sorry, in Bethesda, the Mindfulness Center training program. She's executive director of Science for Health Energy, and she really has an incredible resume in terms of her both clinical and research experience in this whole area of mind-body medicine and meditation in particular. We were talking a little bit earlier, and hopefully she'll share some of that work that she's been doing over at Children's Hospital in VA using mind-body meditations to treat chronic pain conditions in this population. It is my privilege tonight to introduce Dr. Norris, and thank you for being here.
Thank you so much for having me. Really a pleasure.
You just push to the right.
To advance.
And then you're on right after.
Well, we could leave it here for a while. We'll come back to it. Good evening. Well, I have to wonder what brings you all out on a rainy Tuesday night to hear a talk, and I recognize some faces here that I haven't seen for a while. But please tell me, are you patients of Dr. Kaplan's at the Kaplan Center? Are you any of you therapists yourself? Who here are patients at the center? A good proportion, so almost sort. Will be tomorrow. And who here is a therapist of some sort? Does some healing work? Okay, you can read. Yep. All right. And then what are the other interests? Scientists. Clients at the Mindfulness Center. Hello. Well, thank you so much. I am the director of the Mindfulness Center in Bethesda, Maryland, and also a program at American University. And my interest is in the research that, along the same lines as Dr. Kaplan's, what's going on in terms of mind-body therapies and mind-body approaches to well-being. Hopefully this evening we'll be able to identify some of the therapeutic elements of mindfulness that are useful in a clinical setting. I know Dr. Kaplan's been associated with NCAM since its inception, back when it was an office and not a center. And I have also followed their research path, what they've been funding, what they've been interested in since they opened. And the very first questions that NCAM was asking was, do any of these complementary and alternative practices have any clinical benefits? And lo and behold, we started getting some results coming back in that the answer was yes. And the earliest research, it almost seemed like it was designed to, who knows what kind of answers they were going to find. But we started finding, and indeed, there were clinical benefits. So the second line of question was, how could this be? What on earth are the mechanisms of action by which these interventions are working? So we'll take a look at some of the clinical research and the outcomes of the use of these programs, and being able to identify the physiological mechanisms of these mindfulness practices, the mechanisms of action. Most recently, NCAM has started to focus their research efforts on yet a third level of questioning. First off, they asked, did it have any effects? Second off, they asked, if so, how can this be? What are the mechanisms of action? Nowadays, the question is turning to, wait a minute, what are you doing? What exactly are you doing? You said yoga's good for low back pain. Does that mean if I go to a hot yoga class down the street that that's going to be as good as a yin yoga class over here? And what exactly are these interventions that are effective? So we'll look at all of these areas of treatment. In terms of treatment goals, I often speak with therapists and I ask them, consider what your treatment goals are. What are your personal intentions? Are you aware of the power of the placebo, which is really the power of belief, the power of what you believe. But guess what? Not only are you the consumer's beliefs important, but the research shows that your providers' beliefs make a difference. So when physicians were told one thing about the study that was being done and they believed that, it made an impact on the outcome of the study. So whether you're a consumer or a provider, the power of the placebo, the power of belief is important to consider. And the power of the mind, which is really what we're finding in terms of using mindfulness. We're tapping into the power of the mind. Okay, great. So what you believe makes a huge difference. And in terms of treatment of pain, the power of belief can be over 90%. The placebo effect on clinical trials on pain medications can be over 90%. That's great. Now that you know that, the next question is, how do I tap into that? Do I just sit here, I believe I'm going to feel fine. What do we do? So we'll look at what's working. There are many different perspectives of human behavior and function. We can look at things from a neurochemical perspective, and obviously when we talk about depression and other types of mental health, some people say, oh, but I have a biochemical imbalance. And we treat these conditions with biochemicals, pharmaceuticals, antidepressant medications, and so forth, as if it's a neurochemical problem. Another approach would be to consider it an immunological perspective or a hormonal perspective. And obviously some people say my mood is based on the hormones. Another approach to understanding human behavior and function is a structural perspective. What's going on in the neural structures of the brain? How is the amygdala affected? How is the anterior cingulate cortex affected? And so forth. And the various functions of the brain. Another perspective is the energetic perspective, and we'll look at this also in terms of electroencephalography and MRIs and so forth. And most recently, the genetics of health is getting a lot of interest with the new concepts, actually Lamarckian concepts of epigenetics, that is inheritance of acquired characteristics, that we can indeed impact the status of our genes, and that this impact is something that gets passed on to future generations. And a lot of this is being done in nutritional studies, with nutritional impacts being shown to have lasting effects even up to 12 and 13 generations out. We can also look at things from a behavioral perspective and a clinical perspective, and obviously the realms of psychotherapy and psychiatry approach things from the behavioral perspective as well. I'm sure I was told I have a very educated audience tonight, so I will assume that you have some idea of the pathways of the stress response and the relevance of stress in terms of our clinical health. The stress response begins actually with the perceptory organs such as the eyes or the ears or the imagination, and impacts the hypothalamus, which then sends a message to the pituitary gland, both located in the center of the brain, which then sends a message down to the adrenal glands, releasing adrenaline and cortisol, which has a global impact on the whole body. So here's the process by which the hypothalamus stimulates the pituitary and the adrenal cortex, releasing cortisol and adrenaline, and a feedback up to the brain. The hypothalamus is up there basically, I liken it to a nervous mother. It's up there going, are we okay? Is there a problem? Is everything all right? And it wants constant reassurance. It's looking for a lot of feedback. And when it gets feedback that everything's okay, then it relaxes. It sends a different sequence of messages to the pituitary and the adrenals. But if it's not getting that reassurance, it sends out an alert. Why this is important is because of all of the other bodily functions that are regulated in this system. So let's take a look, for example, at what the pituitary is doing when it's not trying to regulate the stress response. The pituitary is regulating levels of growth hormone. You think, well, that's nice for children. What's growth hormone doing in adults? It's essential for the healing response. It's elicited when we sleep. Good quality sleep is when we release growth hormone. And if we're otherwise preoccupied with the stress response, we're not adequately modulating and producing the growth hormone that's needed. Thyroid stimulating hormone. And know of anybody taking thyroid, synthroid hormones? Sure. So if this system is busy with the stress response, activating the stress response, then it's not correctly modulating and producing the various thyroid stimulating hormones. Gonadotropic hormone, luteinizing hormone, all the reproductive hormones are also affected by the anterior pituitary. So again, in a stress situation, the pituitary stops with these more long-term functional survival practices and focuses on the short-term survival, eliciting the stress response. Also, the posterior pituitary releasing oxytocin, vasopressin. We'll look at the roles of these hormones, neurotransmitters, in a moment. So that was the pituitary. What about the adrenal glands? Conveniently located just above the kidneys in your back, which is relevant to yoga teachers to know where they're located, so we can do things to soothe the adrenal glands. The adrenal cortex releases glucocorticoids, which are relevant for regulating blood sugar, insulin function. The mineral corticoids. You might wonder, how can stress play a role in development of osteoporosis? Well, the mineral corticoids are essential for regulating deposition of minerals in the bone and bone density and so forth. So long-term chronic stress, which interferes with the mineral corticoids, will interfere with the normal processes of bone replenishment. And again, the sex hormones.